I want to just start, because I'm sure you've been following this case, with your reaction when you heard the police mention yesterday that she was having issues with the menopause.
To be very honest, when I heard it yesterday in the police statement, I was horrified to hear that information that people might choose to keep so personal and so private was being shared so publicly. But today I have read the statement from the family, who tell us that they were very aware that that was being shared specifically to try to stop some of the speculation and stories that were being shared, which they are finding so hurtful.
Yeah, and a lot of those stories and speculation being shared on social media that we won't go anywhere near on this programme, Diane.
No.
But, I mean, in your experience, I mean, have you met individuals, the family described her as going into crisis because of the perimenopause. So, I know it's different for everyone, but have you met people who've gone into crisis?
Yeah, you're absolutely right. It is different for everybody. And obviously, I can't comment regarding Nicola. I don't know her or her family, and I wouldn't want to do that. It would not be right to do so. But as far as other people are concerned, menopause is a very individual experience. 1 in 4 will have no symptoms at all. 3 out of 4 will have symptoms, and 1 in 4 will describe those symptoms as debilitating, so significantly affecting their quality of life. And that could be physical symptoms, it could be cognitive, things like changes to memory and concentration, and equally it could be psychological symptoms, so things like increased anxiety, a feeling of flatness and low mood, perhaps changes to levels of confidence. So for some individuals, they certainly will experience, as I say, what they would describe as a debilitating time.
Yeah, and you say on your website that the hardest thing about menopause is not having the right education and information before it comes along. I mean, what needs to be done to make sure that people do have that info and the education about it? Not just people who get the menopause, but those of us who don't, and supporting people who will have it.
Yeah, absolutely. And I'm so glad that you've mentioned the people who don't experience it too, because half of the population will experience menopause directly. The other half will not go through their life without knowing somebody who experiences menopause. So it's vital that we all have a general understanding. And back in 2018, I launched something called the Make Menopause Matter campaign, which was specifically aimed at improving education for all of us so that we all grow up having some idea of what menopause is. So we have campaigned for menopause to be included in the school curriculum successfully in England and Scotland. But we would also like to see all of our GPs taught about menopause so that they all have an understanding that allows them to recognise what can be a significant number of different symptoms when their patients approach them. And currently we're in a situation where, to be honest, we have done our medical health professionals a huge disservice by not giving them that education across the board. And I would also very much like to see this government back a public health campaign for menopause to bring education and information to everybody.
Okay, well, they'll be watching, we hope. Diane Danzebrink, I do appreciate your time and wish you all the very best of luck in your work. That message has got out there loud and clear. So thank you very much this evening, Diane. Thank you.